When patients come and talk to me about their menopausal symptoms, or they may be interested in starting some kind of hormone therapy, we kind of get a very thorough history, kind of go through what their symptoms are, and kind of discuss all of the options to manage those symptoms. Sometimes that might be with hormones, and other times they may not either be a good candidate for hormones, or those may not be really indicated for the conditions that they're talking about. I do have a strong interest in weight loss and helping women through that and navigating those challenges, because it can be very difficult, especially as we kind of navigate through the perimenopause and menopausal years. So a lot of times when they first come in, we'll get a very thorough history, get weight and blood pressure. We have a special scale that can measure their body fat and all of that. Usually might do some lab work, especially if they haven't had that done already with their primary care provider, just so we can kind of get a good baseline of other health conditions that can contribute to weight gain or difficulty losing weight. And then kind of once we go through all of that and talk about what their goals are, that can kind of help guide what we can do to help them reach their goals. Usually we're going to start with, for sure, some diet and exercise education, and then we may end up needing to add in some medication to help with that. There are a lot of different medication options, stimulants versus some of the other like semaglutide or things like that can help them to manage their weight. So when a patient comes in and they are complaining of low libido or a low sex drive, again, we kind of want to make sure we get a good history, just to make sure that we can kind of understand the relationship status, if there's any pain or dryness, so that we can address all of those issues. And if everything else in that regard is pretty normal, sometimes just as we age, or just busy women, sometimes sex gets kind of put on the back burner, as they say, that we don't really think about that. We don't feel like we have time for it. And so again, just kind of talking through all of that process and things that they can do as far as like erotic novels or things like that to kind of help get their mind in the right place. There's a huge mental component for women. Sometimes we can draw blood, again, to kind of check hormone levels. If the testosterone level is low, we can supplement that, typically with a topical cream that we have compounded. And then we kind of monitor testosterone levels to make sure that they get in a normal range without any side effects, but can have an improvement. Sometimes, let's say maybe their testosterone level is normal and they need some other ways to help manage those symptoms. There are a couple of FDA-approved treatment options that are available, so we could consider those. There's also some other compounded creams that can be applied prior to intercourse that can help with blood flow and things like that.